Hello, my name is Louis South, and we're here today through the auspices of Ithaca College to hold a webinar where we view and speak to each other concerning a community project. It has to do with a model we're creating for healthcare or health period in the community where I live here in Los Angeles. It's called Region 6 in Council District 10. First of all, I'd like to ask for understanding that Los Angeles is like any city in America. It doesn't matter the size. We're all having stresses that have to do with life and surviving and doing well. And so I'd like you to know that things are going on in communities around America right now where citizens are looking at this. We're just not sitting and waiting for anything. We're not emotional, we're not upset. We live on, no matter what's going on. And so I'm here to, first of all, say to you that myself, I give thanks. I give thanks to the Father, the great Father, God, for all the things that I have. I have gratefulness for all that he's offered me and given to me without me asking. And when I ask, he gives me abundantly. So I want to say that it is important to always turn back and look and remember that, you know, who's responsible for where you're going in life and what's happening. And for me, that's the thing. Further, I'd like to thank my family, who are all passed now, moved on to the other world. I'm the last one left out of my nuclear family, mother, father, one sister, one brother, all passed. And so it still feels good that I have all those memories to live on and move forward with. Very important, because we must live life in a way that is centered, focused. Having track of what time we're in and where we're going is very important. Again, we're here about health, and we're here to move on with the understanding of things that are important to us during this time, things that we need to begin to look at before we even start talking to each other. You know, culture has a lot to do with what I'm about. I'm in a community with many different people. We have to share the space. And so as we move forward, we have to find ways for that to happen so that we can build upon whatever we're doing. All right. And so understanding coming together is essential, and coming together in order to be able to do something together is essential. So how do we do that? Well, we don't have to talk about it. We just have to live it. And that's the important part, you know, to understand that what we're doing is important. Simply how to say hello. For a lot of people, you know, they're very cool and they don't want to say hello and they're walking, they keep walking. But in our neighborhood here, we say hello to everybody that passes or we pass. All right, that's very important. Moving right ahead then, the world is under a lot of stresses, but we don't have to fall apart behind it. What's essential and necessary is that we are ready to be the difference that we want to see, that change, whatever needs to happen. So as we are growing and developing still in life, that never stops, we come to places where we can actually accomplish. First and foremost, though, is the coming together. And I want to say, specifically, the community needs more in all that is about medical services. There are some residents in Jefferson Park, that's here where I live in Los Angeles, Region 6 of Council District 10, regardless of background differences, who think it would be great if there was a new institution to bring in medical support services, to get referrals from medical businesses and other participating institutions in the community. If we could cultivate relationships with viable existing referral businesses, that would erase all illusions that Ithaca College is coming here to compete for patients. No. Ithaca College has expressed themselves. The Physician's Assistance Program wants to come to Los Angeles to be part of the some ideas I shared, and they're scattered here and there, but we have a great Dr. Salashore, who is head of the Physician's Assistants in Ithaca College. And I want you to know that she's worth listening to. All the doctors that I ever have come into my programs where I speak and they speak, they're really dynamic, all right? Dr. Paul Song couldn't make it today. He's at a conference. However, Dr. Gilberto Rosales, he's also a resident right here where I live, just half a block away from me. And we've known each other for years. He has his own practice as an internal medicine doctor, and he's going to speak today. Speaking of him, I'm about to introduce him to you. I want to say, first, what is this? What we're talking about, what we're asking for in the community here is that this medical services model is a medical support services. So it's supporting whatever medical services exist in the community already. And they're not going to come and try to take patients away from doctors, all right? They want to enhance whatever exists. And so those patients and doctors who don't think that's a bad idea, welcome. And we will have, that's essential, that we have the cooperation of doctors who are here already being part of this. And we already have that. I have 4 doctors that's very much a part of this, looking at things with me, and we'll be moving on to introduce you to at different times with them. Anyway, right now, I want to move to, besides this being, we're saying this should be a nonprofit. Why? Because nonprofit starts out from the standpoint of finding what's the needs in the community and then developing a business plan around that. All right, but primarily you have to run that plan. It's not the business first, it's the need that you're dealing with in setting up the nonprofit status first and foremost. Many different ways to go at this, because there's also the interaction that happens between businesses that are profit motivated first and foremost. That's definitely part of this, that many doctors' offices are for-profit businesses. So we entertain and look at that is essential and necessary, and for us to envision that and allow that to happen. All right, moving right along, I'm going to introduce to you now Dr. Dr. Gilberto Rosales, and he's going to speak now and get us focused on whatever we should be looking at now, what he's looking at, why he's part of this.
Thank you, Louis. Thank you, everybody, for making me part of this meeting. As a member of the medical profession who lives in this neighborhood, I welcome the development of any entity, any program, which has the residents' health best interests at heart. And I'm willing to participate to the extent that I'm able to make this possible. Let me just tell you what I think and how did we get, and why is this happening? And several reasons. This is very common knowledge that you can look up. But essentially what happened is that the pandemic, the COVID-19 pandemic, revealed to us the state, revealed to the whole country and to the whole world, the state of the healthcare delivery system in the United States, and the extent of the damage caused by the COVID-19 pandemic even made it worse. We learned some very hard lessons that hopefully we can recover and build from there and prepare ourselves And this is the main purpose of this meeting, because I think we should be prepared, well prepared, and institutions or entities like this physician's assistant program is a very, very good thing that can happen in our community. Uh, First of all, like I said, the state of the uh, or the healthcare system, or delivery system in the United States, we know that we have a deficit in providers. We need more uh, doctors. We need more doctors that are trained in the United States. We need physician's assistants, registered nurses that are trained in the United States, preferably. And we need to encourage that in our community. The healthcare cost is skyrocketing, even with the government subsidies. It's so for some families, some individuals, it's very hard to continue paying these exorbitant amount of premiums monthly, while at the same time they have a very difficult time, reaching their providers, because most of them are overwhelmed with patients, and most of them don't work with the certain insurances are that are government based. Um, and then you add to that the cultural and language and socioeconomic barriers of all this population, and it really makes it difficult to deliver a good health practice to these patients. The damage that was caused by the pandemic, millions of deaths, uh, economic loss. A lot of our uh, our families and friends died. They lost their jobs. They lost their businesses. A lot of homelessness, the riots, and even psychological. A lot of the sequela from the pandemic, has been mostly, depression, anxiety, suicides, and just the lack of socialization that that happened because of this. Our young people, uh, they just got, they just hid themselves in their social media, not interacting person to person. So that caused a lot of that has caused a lot of problems socially. So the lessons that we learned from this pandemic was that we were not prepared. Our infrastructure, was lacking. We didn't have enough hospital with ICU beds. We didn't have enough personnel to manage them. We didn't have enough, equipment. Things like ventilators. And even uh, personal protection equipment, we didn't have enough, and unfortunately, we relied on other countries to provide us for that, for those things, and it's such chaos. So let this be like a dress rehearsal for all the coming pandemics that will come. We know that they will come. It's just a matter of time. One of the sectors that was really, I think, prepared, and they were happy to be prepared and to be contributing, was the big pharma. They were always there, looking to make a buck. And you tell them you need this medicine, you ask them to develop this vaccine, and they have the equipment, they have the technology, the science, and they did it in record time. It's amazing. But I think they were prepared. So we should be prepared at the personal, family, community level, county level. So that's the reason why I think we're here to prepare. We cannot rely on government to meet all our needs. We need grassroots movements. We need ideas. We need leaders like Lewis, and we need